Professor, it's a pleasure. Tell us about your findings.
Well, thank you very much for interviewing me. What we tried to find out in Sheba Medical Center, where we vaccinated more than 9,000 employees and followed them very, very carefully for the effects of the first dose and after of the Pfizer vaccine, we found out that after 3 and 4 weeks of the first dose given, we reach up to 84% protection against severe disease. Now, if you follow up to the 4th week, and we believe that most of the effect is due to the first vaccine because the second one didn't catch yet, we got even more than 94%, which I think is very important finding, especially for countries like the UK, who decided to give a single shot of the vaccine.
What does this mean for herd immunity, and at what point society will reach that level?
Well, it means first that after the 4th week, as we believe, people can be, I would say, careful. They still need to remain careful, keep up social distancing and put on the mask, but they can be quite, I would say, relieved and less pressured from the fact of being infected or even dying. By the way, the Ministry of Health of Israel published also yesterday their results, which show up that protection by the 2 shots of the vaccine, of the Pfizer vaccine, protects up to 99% from death from the coronavirus, which is an incredible result. So our message is just go and vaccinate, and to any country organize a large vaccination program as has been done in Israel.
The other big part of it is the transmission effect. We were all waiting to see if the vaccines prevented asymptomatic transmission. Does your study corroborate that?
Well, we don't know that yet, but we do believe that at least part of that effect is due to the fact that there is less transmission, although it wasn't studied yet. We are working on it right now, and we will publish it, I hope, very shortly regarding the viral load of the people who got vaccinated and still got the disease. I can tell you that we do see a decrease in the viral load, which probably signifies that there is less transmission. But again, the main message is the self-protection, and therefore any people should at least attempt to vaccinate in every country, I believe, in the world, the USA, the Europe, and other countries in the world should do their utmost to vaccinate their own people.
Yep.
And Israel has been quite successful in that.
Professor, what do you think this means about the way that governments should treat variants? Clearly, there are going to be more variants by the time we get to next winter. What are we learning now that will determine the path that we take then?
Well, of course, all those mutations do affect at least potentially, the effectiveness of the vaccine as well as the transmission rate. But you should always remember that it's not all or none. At the end, it might mean, it still didn't mean that the vaccine protects a little bit less. But once we will be able to vaccinate the entire country, then we do believe there will be also herd immunity and less transmission of the virus from one person to another. And another issue is the fact that the Pfizer vaccine or the Moderna vaccines are very easy to modify. So I believe that in the future, what will happen is that each year probably we will find ourselves being vaccinated like we do with flu vaccine. I don't see any problem with that. But again, we are not there yet. So I wouldn't worry that much in the future. Right now, it's part of the missions or the threats we are facing.